9-year-old boy comes to the emergency room. He's nauseous and he's been vomiting. His mother tells you that he's been running a fever for the last 2 days, but the pain's really gotten worse over the last 4 hours. You ask him, how much pain are you feeling right now? On a scale of 1 to 10, 1 being no pain at all, and 10 being the worst pain you've ever felt in your life. He looks at you, and though he's not quite yet green in the face, he gives you an honest 8. You decide to do a physical exam. You push on his belly a little bit, just here and there, and you push on his right side, and it hurts on his right side. You push on his left side, and it hurts on his right side still. You ask him to raise his leg, and it still hurts on his right side. You wonder, what's going on? You take a good hard look at him, and you wonder, this boy's pain is in the right side of his belly, a little bit lower. And you ponder, what can we do here? Let's dig deeper. We can peel away a top layer, and I don't really see anything here. So let's see if we can find anything more. Let's dig even deeper. What can you do? But you confirm your suspicion of acute appendicitis. The appendix is a vestigial structure that arises at the start of the large intestine. There are various theories regarding its existence, but no one really knows for sure, other than it serves as a nidus for infection. This is an obvious inefficiency. But how can we use this inefficiency to our advantage to help the patient? Well, it turns out that the appendix sits right next to the lining of the belly, and that lining is connected all around the belly. So when you push on different sides of him, that lining that's in contact with the appendix moves it, and it hurts it, and that's why it hurts him in that right side of his belly in the bottom. Turns out that the appendix also sits next to one of the muscles that we use to flex our hip. And when you flex your hip and that muscle contracts, that also makes that appendix really angry. And when it gets angry, it hurts. We've used imaging to know and confirm this diagnosis. And we've not only confirmed that the boy has appendicitis, we've confirmed that there aren't any complications of appendicitis. Some of these complications can be really devastating. So now you know that there's still time to go in there and take it out and help this little boy feel better. Well, that little boy was me. I was soon in the operating room where the surgeon, knowing exactly where to go because of this imaging and what she was getting into, carefully corrected my inefficiency. Even though appendicitis is a fairly routine diagnosis, for me, at the age of 9, it was anything but. I was fascinated by the art of physical diagnosis. Even more, I was amazed at the extraordinary peek inside my own body. My doctor used complementary techniques of the physical exam and imaging to figure out why I was in so much pain. In 1895, a scientist named Willem Röntgen took the first x-ray of his wife's hand. You can even see her gold ring on her finger there. Well, in imaging, we still use x-rays today, but now there are many different ways to look inside the patient, all of which reveal to us different of the puzzle. Ultrasound uses soft spots in the brain when we're looking at babies' brains to see natural windows where we can peek inside. We can use nuclear medicine to see which parts of a brain in a patient are active or inactive to diagnose diseases such as Parkinson's or epilepsy. CT stands for computed tomography. We use special types of x-rays that go through the patient in a circle to make these images. We can very quickly see if someone is suffering from a severe condition such as a bleed in the brain. MRI stands for magnetic resonance imaging. What does that mean? We actually manipulate the protons within a patient's body inside of a giant magnet to create these beautifully detailed images. We've come a long way since 1895. Just as my doctor used his patient's history, physical exam, and imaging to find my appendicitis, all of these imaging techniques are complementary to one another. In 1895, we didn't really have MRI at all. It was not even a figment in anyone's imagination. But today, we use it to study the bends and the curves on the surface of a patient's brain, the peaks and the valleys where conscience resides. We can dig even deeper than this. We can travel along the electrical highways that allow different parts of the brain to talk to one another. These are the pathways that tell us, that stove is hot, please remove your hand. They let us know when a patient is waiting for us in the waiting room, and we know that we've seen this patient before. They let us know when a loved one is at the airport, and then they let us reach our hands out to hug them. These are the same pathways that let me as a little kid know that my stomach was hurting and I needed to do something about it. With these pathways, we can tell where things are going. The directionality is embedded within this information. Blue is up and down, green is front and back, and red is right and left. When an injury or a tumor is in the way, we can see where there's a roadblock and how these pathways can move around and create detours. Here we're controlling particles smaller than atoms to look inside of patients and treat them. While this may seem like science fiction, it's performed every day in hospitals around the world. Will you be the one to go even further than protons? Will you be the one to image and treat patients based on quarks and leptons? I urge you to dig deeper. I urge you to keep being curious. Don't look back. Keep digging. That little boy with the bellyache is depending on you.